Hello, I'm Jonathan Best and I'm the Chief Operating Officer for Acute Services here in Greater Glasgow and Clyde. I wanted to take a minute to reflect on the last 3 months and in particular the response from all of our staff and services during the COVID-19 pandemic. I want to thank our teams across the board for their commitment and their dedication to our patients and their families. It's hard to believe just how much our lives have changed. Aside from work, our home lives have changed beyond all recognition, and it's hard to foresee things ever being the same again. There are too many teams to mention, but what they all have in common is their unquestioning commitment to their patients. Everyone stepped up, and we've all learned and adapted together. In our acute world, and in the community too, our staff have willingly and enthusiastically embraced their new roles. There have been secretaries becoming healthcare support workers, dentists taking on new roles in ICU. The list is endless, as is our appreciation of their willingness to adapt to the changing situation. Our management colleagues too, both clinical and non-clinical roles, have been faced with new challenges and have shown resilience and a can-do attitude in finding solutions. Student doctors and student nurses answered the call in March and began their careers with us much earlier than expected. They are admirable and deserve our heartfelt thanks. All of this was done with skill and compassion at all levels and sums up what we do. We should be proud of our teams and services, and I know that I am. Partnership working has never been more important, and we need to take pride in how well this has worked, and it will be one of the great positives from the pandemic. These new relationships we formed must be maintained going forward and used to keep improving our services. COVID has not gone away. Our teams continue to manage patients with the virus, and we're now learning to care for patients who are shielding, which is new. Others are planning how we begin to step up services which have paused to be delivered in this new COVID world. I'm very proud of how our workforce has risen to the challenge COVID has presented to us. I remember seeing a video of Anne McFadgen, one of our domestics, who had been in the QE for 5 weeks, 3 of which she was in a coma. Colleagues lined the route out of hospital as her daughter Sharon walked her through the front door. Sharon praised the ICU team, who had not just saved her mother's life, but shown dedication and compassion throughout. This was person-centred care at its very best. We now face new challenges in restarting services and looking at how we deal with social distancing. I am confident our teams can find solutions to all of those challenges ahead. Thank you.